I actually went to the CDC website, and it doesn't say anything about that, but I saw on another website that it is possible to have that. But we're gonna go with the standard. The standard is Rocky Mountain spotted fever usually has it on the palm and soles of the feet. Lyme's disease usually has it as a bullseye rash. So yes, we can Google anything and find any answer we want. And unfortunately, these slides, I did not look at them close enough, and they made one mistake, or another addition that I didn't want in there. So that's it here. Okay. Which one is that? Okay, so we're looking at the measles one, the group slide, which one? I don't have page numbers on this. Okay, so he's asking why it says it's viral and we're treating with antibiotics, because a lot of times we get secondary infections that need antibiotics, so they go ahead and treat it with an antibiotic. But it is viral. Thank you. That's why we have a vaccine for it, because it's virally transmitted. And if that didn't make sense, please let me know and I will clear that up. Cat scratch, page 342. And in your book, it's on page 1230. And you do get it from a cat. It usually are in children, and it usually goes away on its own. But it can cause problems. One of the symptoms is a fever and the lymphadenopathy. So they have increased lymph nodes, and it's usually close to the bite. So if they get scratched on the hand, the lymph node under that arm is going to be swollen up. Or if they get scratched on their face, the cervical lymph nodes are going to get swollen up. So really, if you were to see a child, and we had a child like this admitted a couple of years ago when I was doing their rotation on a pediatric unit, and they were suspecting cat scratch. They didn't know for sure, but the child came in, they had a fever for 2 weeks, they treated it with antibiotics for other things. Nothing was getting, affecting it, so then they were testing it for cat scratch, and I didn't get to stay to see if it came back positive. So they did this serology test to see if that's what it was, but they also had a history of a scratch from the cat. So that's where they, as a nurse, your role is going to be to ask about that. Has he been, he's got a fever, does he have any wounds? Look at his skin. Oh, I see a scratch. Is that your own cat or is that a strange cat? So as a nurse, you instruct the parents after the fact. I know it's like closing the door after the cow has already left, but you instruct the parents to instruct their children not to pet strange cats. And that's really hard to do. I love cats, and I would pet every cat I could see. And it's hard not to do that. But as children, they are very, very aggressive and can jump at the cat, and the cat's going to automatically defend itself. So sometimes the symptoms can last for months, but they're not progressing, so we're not getting concerned. So that means that the swollen lymph nodes can last for months at a time. But the child's up and playing, they're not running a fever, they don't have any other level of consciousness change. They're not getting lethargic, they're not having headaches, they're not throwing up. They just have swollen lymph nodes. So we're just going to keep watching them and keep encouraging the parents to continue to keep an eye on that.
Ms. Briggs, I just want to make sure you were recording.
I should be recording in two places. It's recording to my computer and it's recording to the, that was 50 on Jim. Well, that's your capture, but it's recording on Zoom.
Great, thank you.
It's recording on Zoom, make sure. Thank you, Kate. Encephalitis is the next one. Let's take a deep breath, because I'm gonna tell you some things you're gonna go, oh, I'm supposed to know. Encephalitis is more of a description than it is a condition. No, it's not. It can be caused from lots of different things. Bacterial, fungal, viral. It could be a result that encephalitis is the inflammation in the, is the inflammation of the central nervous system. This is on page 1139. And there's a good box there on 1139 that tells you what to look out for. And I know you guys have had fundamentals and you learned about neurological focused assessments. Don't forget those. So if you have a child that's got a fever or encephalitis, or they're suspecting that they might have central nervous system involvement, these are some things you're going to be watching for. Malaise, which is just basically feeling really tired. And that is unusual with children. We expect them to fall asleep really fast and then get up and run all day long. But if they're just listless, fever, headache, dizziness, apathy, they just don't care. And SpongeBob comes on and they don't know. They don't even look at it. Nupal rigidity, ataxia, which is decreased muscle coordination. These are some things that we can see. And then some severe cases, high fever, stupor, seizures, disorientation. Please don't write these down, they're all in that box. These are things as nurses, we are looking at that child. Has something changed? I went in at 9 o'clock, gave him his medicine, so he was up watching TV. I go in at 11:30 because I had a really busy day, and he is rubbing his head or throwing up. Something has changed. So we're always paying attention to our patient, reassessing, and documenting and acting on whatever needs to be acted on. So if I went in there and saw that change, I would think, oh no, he's got some more pressure, and you're gonna be getting this in neuro this week, so park this at the back of your head. The neuro changes are happening. I'm gonna be contacting someone or doing something about that. So encephalitis, so that's the biggest thing you're gonna be looking at. You're gonna be doing your focused assessment, looking at the PERLA, orientation, alertness, awareness, because you want to prevent any further deterioration. That's what the neurological sequela means. It means further problems. We're going to give the medications as ordered, whether it needs to be an antibiotic, an antiviral, antifungal, whatever it is. We can be giving that medication, knowing the signs and symptoms to watch for, and taking care of that client. On page 339, and in your book, it's on page 1140. These are viral, and they're transmitted through a bite. The infected saliva of a mammal, and they give it to the person. So once it injects the individual, it gets into their muscle cells and then spreads out. So that's why they get that rigidity, that spasm, and they can die from it. If left untreated, it can cause death. So that is why if a child gets bit, you immediately start them on the medication. You start them on the vaccine, the rabies vaccine, and immunoglobulin. Your book goes through a very clear pattern of what we give and when. It also says on day 10, they can stop the injections if the animal was caught and he has not shown any signs of having the rabies. So see, one of the biggest things that a nurse is gonna have to do is, number one, stay calm and calm down the family, because they're gonna be anxious. The child's gonna be anxious because they're gonna get shots, and who wants that? And they're painful shots. They have a wound. So it says there in your book and on your slide, thorough cleansing of the wound. Make sure that you get it completely cleaned out. You don't like it, it hurts already, and you're gonna have to really scrub on it and get it good and clean. The rabies vaccine and the rabies immunoglobulin. Then you're gonna educate them on staying away from stray animals or animals that are not their own. Spray syndrome, we've covered that a little bit in another lecture, but we're gonna continue with this one. They're not really sure why it happens. They just know that a combination of viruses and probably aspirin causes this disease. It's on page 1141 in your book. Early diagnosis. So what they're looking for, they're usually having a lot of profound vomiting. I mean, they're just, the swelling has gone up and they're just throwing up and they get severely dehydrated. So that's why we have the INO. We're going to be giving them IVs. We're going to be making sure they're getting the fluids, that they're peeing, that they're drinking if they can. It also has a problem with the liver function. So it distorts that. It can damage the liver. So we're checking the liver functions. So since this is such a weird disease and the treatment is yucky, we wanted our main focus as a nurse is to instruct parents not to give any medications containing aspirin, salicylate, salicylic acid, I'm sorry, I can't say that one. Any of those things, Pepto-Bismol, there's lots of medications that have that aspirin hiding in it, or it might say do not give to children under the age of 18. So you just want to make sure that you're talking to your clients and finding out, are there anything over the counter that you're taking? Because a lot of times patients don't understand and family don't understand, I'm not taking any medications, which means I'm not taking anything that a doctor has prescribed. I don't have to take a blood pressure medicine, I don't have to take a diabetic medicine, so I'm not taking any medications. They don't understand that vitamins and over-the-counter medications also count, and this, in this case, can be deadly. So we need to make sure that they're looking at their containers and reading them and understanding and reading that word. Do I see salicylic acid on there? Do I see salicylates on there? Does it say anything about the children not taking this medication? So that's our nursing focus, is prevention. Any questions so far? As you'll see that we've done with the slides, but I have a couple of things to show you and to do. I'm a little nervous about one of them. I'm probably going to chicken out on one of them, but to show you something.